Sexual mishaps, when passion takes an unexpected turn. Sex is often portrayed as a seamless, passionate dance, but anyone who's been in the heat of the moment knows it can sometimes feel more like a comedy of errors. From awkward missteps to downright painful blunders, sexual mishaps are a universal, if rarely discussed, part of human intimacy. Below, we explore some common and cringe-worthy sexual mishaps, shedding light on the messy human side of getting it on. Note: this article contains explicit content and is intended for mature audiences. 1. The toothy blowjob, a dental disaster. Oral sex is often a crowd pleaser, but when an overzealous partner gets a bit too toothy, pleasure can quickly turn to pain. A scrape of teeth against sensitive skin, especially on the penis or clitoris, can cause wincing, yelping, or even a full stop to the proceedings. In some cases, overeager biting can lead to minor abrasions or bruising, leaving both partners feeling sheepish. Why it happens: enthusiasm, inexperience, or a simple miscalculation of pressure can lead to dental mishaps. Alcohol or distractions, like trying to multitask during oral, can also reduce finesse. How to avoid it? Communication is key. Partners should feel comfortable giving gentle feedback like, "A little softer, please." Using lips to cushion teeth or practicing on a soft object, like a banana for beginners, can help. If teeth are a recurring issue, consider slowing down or using flavored lubricants to enhance glide and reduce friction. 2. The slip and slide, unintentional anal entry. One moment you're enjoying vaginal sex. The next, an unexpected slip leads to an accidental thrust into the anus. This mishap can cause shock, pain, and even injury if the receiving partner isn't prepared or lubricated. The sudden shift can also lead to an awkward pause as both partners process what just happened. Why it happens? The vaginal and anal openings are close neighbors, and in the throes of passion, especially in positions like doggy style or missionary with legs raised, a misaimed thrust can easily go off course. Lack of lubrication or poor lighting can exacerbate the issue. How to avoid it? Slow, deliberate movements and clear communication about intended targets are essential. If anal play is on the table, discuss it beforehand and use plenty of lube to ensure comfort. Checking in with phrases like, "Is this okay?" can prevent surprises. For extra caution, positions with better control, like spooning, can reduce the risk of misdirection. 3. The painful tug, labial mishaps. For those with vulvas, the labia can sometimes get caught in the crossfire of enthusiastic oral or penetrative sex. A partner's teeth or a sudden shift in position can pull or pinch the delicate skin, leading to sharp pain, swelling, or even minor tears. In rare cases, this can cause bleeding and require a break from sexual activity. Why it happens? The labia are highly sensitive and can stretch or fold during sex, especially if the receiving partner moves unexpectedly. Overzealous oral techniques or insufficient lubrication can increase the risk of tugging or pinching. How to avoid it? Partners should take their time during oral sex, using lips and tongue gently to avoid catching skin. Lubrication, whether natural or store-bought, can reduce friction and prevent painful pulls. If a mishap occurs, pause to assess discomfort and apply a cold compress if needed. Persistent pain or bleeding warrants a visit to a healthcare provider. 4. The anal surprise, unexpected mess. Anal sex can be a thrilling adventure, but it comes with the risk of encountering fecal matter. Even with thorough preparation, the rectum is a functional part of the digestive system, and a surprise appearance of stool can derail the mood. This mishap often leads to embarrassment, though it's a natural possibility. Why it happens? The rectum stores waste, and while enemas or douching can reduce the likelihood of mess, they don't eliminate it entirely. Diet, hydration, and timing also play a role in what's present during anal play. How to avoid it? Preparation is key. A high-fiber diet, hydration, and a bowel movement, an hour or two before anal sex, can minimize surprises. Using a condom or a dental dam can make cleanup easier and reduce health risks. Most importantly, both partners should approach anal with a sense of humor and understanding. Accidents happen, and they're not a reflection of anyone's hygiene. Fight the panty scrape, friction burns from fabric. Leaving panties on during sex can add a layer of spontaneity or kink, but it can also lead to painful consequences. The fabric can bunch up, rubbing against the penis or vulva and causing friction burns, abrasions, or even raw, scraped skin. This mishap can leave one or both partners sore for days. Why it happens? Rough or ill-fitting underwear, think lace or synthetic materials, can chafe delicate skin during vigorous movement. Dry conditions or prolonged friction increase the likelihood of irritation. How to avoid it? If keeping panties on is part of the fun, opt for soft, stretchy fabrics like cotton or seamless microfiber. Ensure there's enough lubrication to reduce friction, and consider pulling the fabric aside rather than letting it bunch up. If irritation occurs, clean the area gently and apply a soothing cream like aloe vera or hydrocortisone. 6. Other notable mishaps. The world of sexual misadventures is vast, and no couple is immune to the occasional blunder. Here are a few more common mishaps. Queefing. Air trapped in the vagina during sex can escape with a loud fart-like sound, leading to giggles or embarrassment. It's harmless and caused by movement or position changes. Laugh it off and keep going. Cramp catastrophe. A sudden muscle cramp in the leg, back, or pelvis can halt even the steamiest session. Stretching beforehand and staying hydrated can help prevent this. Condom slippage. A condom that slips off or breaks can cause panic, especially if STI or pregnancy prevention is a concern. Always check sizing and use water-based lube to keep things secure. Allergic reactions. Sensitivity to latex condoms, flavored lubes, or even a partner's body wash can cause itching, redness, or swelling. Patch test new products and opt for hypoallergenic options. Headboard havoc. An overly enthusiastic thrust can lead to a head banging against the headboard or a fall off the bed. Padding or slower movements can prevent these literal headaches. Navigating mishaps with grace. Sexual mishaps are inevitable, but they don't have to ruin the moment or the relationship. The key is to approach them with humor, empathy, and open communication. Here are some tips for handling the aftermath. Pause and check in. If something goes wrong, stop to assess pain or discomfort. Ask, "Are you okay?" And listen without judgment. Laugh it off. A shared chuckle can diffuse embarrassment and remind you both that sex is supposed to be fun, not perfect. Learn and adapt. Use mishaps as learning opportunities. Discuss what went wrong and how to prevent it next time, whether it's more lube, better lighting, or clearer boundaries. Seek medical help if needed. Persistent pain, bleeding, or signs of infection should prompt a visit to a doctor or sexual health clinic. There's no shame in prioritizing your health. Conclusion. Sex is a beautifully messy human experience, and mishaps are just part of the package. From toothy blowjobs to unexpected anal adventures, these moments remind us that intimacy is as much about vulnerability as it is about pleasure. By communicating openly, preparing thoughtfully, and embracing the occasional fumble, partners can turn mishaps into stories that strengthen their bond. So the next time things go awry, take a deep breath, share a laugh, and keep exploring, because even the clumsiest moments can lead to deeper connection. Disclaimer. This article is for informational purposes only and does not constitute medical advice. Always consult a healthcare professional for concerns about sexual health or injuries. By Scott Young, aka Synfamous Gamer.